Dual diagnosis, also called a co-occurring disorder, describes the situation in which a person has one or more mental health disorders in addition to the substance abuse disorder. This is likely more common than you think. Having dual disorders may seem alarming at first, but it may offer relief to understand underlying issues. Learning more about it can put a person's fears to rest. Additionally, considering dual diagnosis treatment options can show those suffering from addiction that it's possible to manage both conditions. Dual diagnosis. Only a qualified counselor, therapist, or other professionals can diagnose co-occurring disorders. A dual diagnosis occurs when the patient has an addiction problem along with another mental disorder. Alcohol and drug addictions tend to develop alongside anxiety, depression, and personality disorders. Sometimes the mental disorder is present when the addiction starts. Other times, an addiction can cause a mental disorder to develop. In either case, the two often feed off each other. This creates an especially volatile, vicious cycle. Co-occurring disorders can be scary for someone who doesn't know that he or she has been suffering from mental illness. Additionally, family members who are unaware of dual diagnosis might not consider how the other mental health condition exacerbates the addiction. And in some scenarios, this means extra shame and blame get thrown around. The signs. As we stated, only a trained professional can actually diagnose co-occurring disorders. But as a loved one of someone with a substance abuse disorder, you should be on the lookout for signs that the one you care about is suffering from dual diagnosis, since this will influence the type of care you seek. With that in mind, some common signs that someone should be considered for a dual diagnosis program include a known diagnosed mental health disorder, withdrawal from family and friends, and sudden behavioral changes. Also, using drugs in dangerous places, with especially dangerous people or through dangerous methods, feelings of being completely out of control of one's use, and stating that they need the drug to function normally. Depending on the type of mental disorder, other symptoms may vary, but they could include things like extreme mood changes within a short period, significant mood highs and lows, and/or avoiding activities they once loved. They might also talk about and/or attempt suicide. Time is of the essence when someone is in this state of mind. Don't delay in helping this individual get into treatment for their co-occurring condition. Treatment programs. There's no one course of treatment that works for every patient with a dual diagnosis, because there are many mental health conditions that can occur alongside addiction. However, all treatment programs address the addictive behavior and specific disorder. The level of care that each patient needs depends on the extent of the addiction and severity of the disorder. A dual diagnosis treatment center, like Crestview Recovery, offers dual diagnosis treatment in several levels of care, like extended care, intensive outpatient, partial hospitalization, and rehab aftercare. Crestview Recovery. Located in Portland, Oregon, Crestview Recovery offers treatment for individuals with co-occurring disorders. We use evidence-based techniques for all types of substance abuse. Our facility offers activities such as skiing, snowboarding, and whitewater rafting. Along with dual diagnosis therapy, our staff of clinicians provide acupuncture, art therapy, individual therapy, and more. Don't let addiction and mental illness rule your life or the lives of your loved ones. You can take back control by enrolling in an addiction treatment program that Crestview Recovery offers. Contact us today at 866-262-0531 so we can help you begin the road to recovery. And if you enjoyed this video, be sure to like, comment, and subscribe.